Hi, I'm Tammy Fontana with All in the Family Counseling Center Private Limited. I am a clinical therapist for just under 2 decades with over 30,000 hours, and I have clinical training in attachment, complex developmental trauma. I'm a clinical sex therapist, so I've done clinical training in that. I've received ongoing supervision and training with some of the top therapists in the world. So I'm a very evidence-based clinical therapist who is used to dealing with very complex and difficult cases and difficult client situations ranging from infidelity, trauma, anxiety, depression, people who have very difficult relationships, who have overwhelming feelings, who may have a hard time communicating and expressing or maintaining relationships. Today, I wanted to answer the common question I get. People will ask me, what does a first session look like? What's going to happen in the first session? Or what's going to happen in therapy? Well, the first session is easy because that's a session where we call it like an intake. I have no idea who you are. So the first thing I want to do is get some context about who you are. If you're coming in as a couple, I want to know who you are and learn a little bit about your relationship. Then usually people have an idea of what they think is their problem. And so we'll spend a little bit of time talking about that. But where I'm really interested in is, what do people want? What is it that you want for yourself, for your life, for your relationship? And that's a really difficult question for a lot of people because they can usually tell me what they don't want. But telling me what you don't want doesn't tell me what you do want, because we can only work towards something we do want. You can't work towards a negative. And the reason I like to spend time on there, and if you're thinking about therapy, you may want to think about what it is you want, not what you don't want, is because most of the time people get their problem diagnosed wrong. So people have this idea that therapy, often people have this idea that therapy is a talking Google, and I'm going to tell them how. Like, they'll come into me, tell me this is their problem, and then I'm going to tell them how to fix it. And the reality is, I do tell people how to fix it, but first of all, they have to get the problem correct. And most of the time people got their problem diagnosed incorrectly. This is why they're stuck. And so we really need to know, what do you want? And most things are not so simple that it's just a, input in and then I give advice out. That is not therapy. Therapy is much more helping people to become aware of how they're looking at things as part of the problem, which could be a function of lack of information, could be a developmental issue, like they don't know how to process feelings. They may have wrong ideas or expectations or belief systems that may be inaccurate or need modifying. So most of the time people get their problem diagnosed wrong because they're looking at things in an incorrect way. So therapy is really helping people to see solutions, see options in ways that they haven't had. I help people see things in ways that they haven't had. I help them become aware of how maybe their partner is experiencing them in a way they weren't aware of. That maybe even though they think they're a good communicator, and in certain settings they're good communicators, like at work, in their relationship they may not be, because relationships and people work differently. A lot of times people are not aware of these things, and that's part of the process of therapy, is helping people accurately define what it is they want, and then I help them understand how to do it. So that's a very custom experience for people. It's not a canned thing, and I'm always trying to assess and see what's going on. I'm looking at people's belief systems, how well self-aware they are, how aware they are of their feelings, and they're able to articulate them or not, kind of where are they at. So a lot of that is done through talking and asking questions. There's never any touching. I'm really trying to get inside to see how people think and process things, because the things that create problems for people in making decisions or changing their behavior is their thinking, their belief systems, and how they process their feelings. These are the things that therapy works with in order to get to the how of what you're going to do. You got to know what you want, and then you got to think if it's realistic. And then you got to see if you're going to be willing to do what's going to be required to get it. And sometimes the requirements to get what you want require emotional skills development, new ways of thinking or looking at things, learning how to set boundaries, learning how to take responsibility for your feelings, and sometimes just getting better information and education to help you do those things. So all of that's sort of covered in a first session, and then I outline what that's going to look like. So thanks. I hope you found that helpful. If you want more information, the information's in the contact below. Thank you.